I think that we will go ahead and shift gears and go to our next speaker. Just to note, we'll be gathering all the questions, so the ones that didn't get answered we'll be sure to follow up with at the end of the presentation, and then also we can follow up with you via email as well. So I'm going to go ahead and introduce John Peacock. Many of you are very familiar with John. He's from Wisconsin Council on Children and Families. He has decades of experience working on public policy, and we're so happy that he's joining us. He'll be talking mainly about what the Affordable Care Act implementation looks like in Wisconsin. John?
Thanks, Danielle. Yeah, as Danielle indicated, I work at the Wisconsin Council on Children and Families, which is, it sounds like maybe a part of state government. It's not. It's a nonprofit agency that's been in existence more than 130 years and is engaged in research, education, and advocacy on children's and families issues. I wear a couple hats at WCCF. I'm the research director, which is kind of the number cruncher in chief, and I'm also the head of the Wisconsin Budget Project, which looks at the effect of state fiscal policy decisions and, to a lesser extent, federal fiscal policy decisions on particularly low-income and disadvantaged families in the state. I'm going to be talking, like Jenny, mostly about the effects of the Affordable Care Act that are aimed at very significantly reducing the number of uninsured Americans and number of uninsured Wisconsinites. As I think Roberta mentioned, there are roughly 50 million uninsured Americans, and the goal is to reduce that by about 3/5, maybe even better. But that's not going to happen automatically. It really depends on whether states take up the option to use what's sometimes called the Medicaid expansion. I'm not wild about that term, and I'll explain that, but it's how we use that Medicaid opportunity in the Affordable Care Act, and how well the federal government and state governments are able to implement the exchanges, which is going to be a complicated process, to really determine how good a job we do in significantly reducing the roughly 50 million uninsured Americans and about 500,000 uninsured Wisconsinites. This first slide is basically a backdrop for the status quo, just showing kind of the trend lines in coverage of people. This is based on the latest Census Bureau data over the period 2000 to 2011, showing the percentage of non-elderly adults who have employer-sponsored insurance. And we were at about 4/5 back in 2000 and are down a little below 2/3, I think, right now. A couple things to notice about that. In Wisconsin, the trend line is the same as at the federal level. We've consistently been above the federal level in terms of percentage of people with employer-sponsored coverage, but the trend line is basically the same. Now, the one thing that's different in Wisconsin is that we've managed to hold the line on the percentage of Wisconsinites who are uninsured, and we've managed to do that by having a stronger safety net through Badger Care than most other states. So that's the good news, and in fact, in 2011 in Wisconsin and at the national level, the percentage of people who are uninsured actually came down, thanks primarily to the part of the Affordable Care Act allowing young adults to be on their parents' coverage. The key here is that if we don't do a good job of implementing the Affordable Care Act, if we say let's just let the marketplace continue to be the solution, this is the trend line. And there are a number of things behind it. It's to some extent it's the recession, the increased number of people who don't have jobs. But it started before that, and there's a lot more behind it than that. The rising cost of health care causing a lot of smaller employers in particular to drop coverage, causing some people to no longer be able to afford to take their employer-offered coverage. And a really big part of it is just the change in the nature of the workforce, of where people are employed, as we move increasingly from a society where a lot of people are in manufacturing to where more and more people are in service sector jobs. where in many cases they just don't have offers of an affordable employer-sponsored insurance. This slide and some of the others that I'm going to use actually use 2010 data. There's some data released in August that combines Census Bureau data and other administrative sources of data to come up with a much more detailed look at the income levels of people who are uninsured state by state, and also offers us county level data that I want to get to in a couple minutes. But just a couple key points from this slide. One is that of the roughly 500,000 non-elderly adults in 2010 who are uninsured, roughly 3/4 of them are adults who are below 400% of the poverty level. And I emphasize that because 400% is the cap on subsidies for coverage through the exchanges. So of the 500,000 uninsured people in Wisconsin, roughly 3/4 are either going to be eligible for the option to fill the current gap in Badger Care, or the subsidized coverage through the exchanges. The other thing I wanted to note here is how Wisconsin and increasingly most states have done a pretty good job of covering kids. Now that number, and it's even smaller in the 2011 data, is nothing to sneeze at. We oftentimes talk about or try to do a little social math with these numbers to try to help put them in perspective. And the social math that a number of us like to use in Wisconsin is to kind of think in terms of Lambeau Field units, picturing 72,000 people in Lambeau Field yelling at the top of their lungs nasty things about the Bears or the Vikings or whatever, but maybe instead yelling, "We want health insurance," because you can fill up 7 Lambeau Fields worth of people in Wisconsin who don't have health insurance now. And one of those Lambeau Fields would be filled with kids. Now those kids, for the most part, and I'll show on the next slide, about 2/3 of them are below 250% of poverty. Now generally speaking, most of the uninsured kids in Wisconsin are going to be eligible for Badger Care already, or at least meet the income test to be eligible for Badger Care, which actually provides subsidies up to 300% of poverty, and people over that level can buy in at the full cost. But why exactly we still have this many kids uninsured is something we need to get a better handle on. Some of them are probably, a small number may be undocumented immigrants who aren't eligible. In some cases, it's just the churn that happens within Badger Care. Some are ineligible because they have offers of employer-sponsored coverage. If their family's over 150% of the poverty level and the employer coverage pays for at least 80% of the premiums, they may be ineligible under state law for that reason, and that will stay pretty much the same under the Affordable Care Act. But still, we ought to be able, under the health care reform law, to make a very significant dent in this number of uninsured kids. Now, I said before that I'm not crazy about the term, the Medicaid expansion, because in Wisconsin, it's a hole in our Badger Care coverage. And that hole is that we have something called the Badger Care Core Plan for childless adults. It was initiated back in 2009 when the state shifted over the childless adults who were in the general assistance Medicaid population, shifted them into this core plan coverage, and then in July of, I may have said 1999, 2009, July of that year, the state expanded Badger Care Core to all childless adults, and I should specify that's adults who don't have dependent children, who aren't custodial parents of dependent children. They were made eligible for Badger Care Core in July of 2009. What happened is there was a surge in enrollment, and it soon became very apparent that the state would go well over the cap on that program that is placed there under federal law. There's a cost neutrality requirement. The state uses federal funding for disproportionate share hospitals, switched that over to this program. to use that as the federal match for this, but there's a cap on that, and so we really couldn't sustainably cover more than roughly 50,000 people in this program. As it became apparent that we were going to shoot past that, the state initiated in October of that year a waiting list for Badger Care Corps. The goal was to lift that waiting list once we got down below that sustainable level, but after that happened back in 2011, the Walker administration didn't lift and hasn't lifted that moratorium on new enrollment. So in this chart, the first set of lines, the blue lines, shows that childless adult enrollment that peaked at about 65,000 adults back in January of 2010 and has dropped very dramatically since then to where it's about 21,000 right now. In the meantime, the waiting list has been skyrocketing. This chart's 2 or 3 months out of date. That waiting list, I believe, is well over 150,000 people now. Now, granted, some of them may not actually be eligible or were eligible before, might not still be eligible. It's not a great proxy for the actual number of people who we could cover by filling this gap in Badger Care, but it's a rough proxy. And if you think of that 150,000 numbers, think again of our Lambeau Field units and 2 Lambeau Fields full of adults who don't have dependent children, who in theory are eligible for Badger Care Corps and yet are on that waiting list and can't get covered. Just the next 2 slides that I'm going to go over pretty quickly, just take that 2010 Census Bureau data, map it out by counties, and the main thing, in this case, this shows the percentage of all the non-elderly adults in each county who could potentially, or who would meet the income eligibility test if we use that Medicaid opportunity in the law to allow them to be covered in Badger Care. And the main point of this slide is to show that although many people think of this or may think of this as a problem, particularly in the more urban counties, it's actually an even bigger problem in the rural counties of the state. This map shows kind of much the same thing. This is the percentage of the non-elderly adults in each county who would meet the 400% test, who would be eligible either for Badger Care if we fill that gap, or at least meet the exchange income ceiling. And the other thing that I should say at this point, I've been talking primarily about the number of uninsured people who can benefit, but the Affordable Care Act will be also extremely helpful for people who are underinsured, people who are in the individual market, who have coverage that may have extremely high deductibles and copays, and it's really stressing those families economically. And we know that that health insurance costs are the primary cause of bankruptcy in this country. And by using exchanges to provide a better option for people in the individual and small group market, we can really help people. And that's particularly a problem. There's a larger number of people who have individual insurance or are insured through a small employee in the rural areas of the state. And I hoped that wouldn't have to phase in like that. I apologize. This is basically a variation of a schematic that both Roberta and Jenny shared with us. I just want to stress a couple of points about it. I think Jenny said, well, she made the excellent point that Medicaid, and in Wisconsin's case, Badger Care, is the foundation that the exchange coverage is building on. And so we're trying to build this framework where everyone up to 400% of poverty, if they don't have access to affordable coverage through an employer, or if they're not elderly in Medicare, can either be covered through Badger Care or get subsidized coverage through the health insurance exchange. Jenny made the point that the goal is to build on the coverage that we have in that, and not that it will be sustained. Now, hopefully that will in fact be the case. That's where part of the law comes in that's called the maintenance of effort requirement. And you may have heard discussion of that because back in the fall of last year, the Walker administration proposed changing Badger Care pretty significantly in ways that the department actually estimated would cause about 60,000 people in the state to lose their Badger Care coverage because of increases in premiums or changes in the rules with respect to who's eligible if they have an offer of employer-sponsored insurance. Some of those changes were approved by federal officials and took effect in July, and Badger Care enrollments dropped by about 17,000 people in the ensuing months. Those changes that were put in effect do not directly affect kids because the Affordable Care Act has this maintenance of effort requirement that protects coverage for kids through 2019. The state needs to maintain its existing standards with respect to kids coverage. So that's kind of from the perspective of of a lot of advocates, one of the sort of less recognized parts of the law that's been extremely important in our state. Now, the maintenance of effort requirements don't protect adults over 138% of the poverty level. The Walker administration could have totally eliminated the coverage for those adults because the state had a deficit. The law says that states that are facing a deficit can reduce their adult coverage down to, well, actually it's 133% of the poverty level. We sort of use 133% and 138% interchangeably because there's a 5% income disregard in the federal law. But the state does have the option of lowering its adult coverage to 138% of the federal poverty level. And so a key decision in the next budget is whether or not the state is going to do that, whether they argue that because of expansion of who's covered in Badger Care, because of the individual mandate, because of the new portals for applying for eligibility, for a lot of different reasons, a lot of already eligible people are likely to be entering Badger Care. Costs are going to be increased because of that, and the Walker administration might recommend to offset those costs actually reducing Badger Care eligibility for adults. I'm hoping they won't because the subsidies that are provided in the exchanges won't necessarily be adequate to make the exchange-based coverage affordable for all those families. But stay tuned. I'll talk about that a little more in some of the other slides. But the other thing I want to point out on this one is that sort of circle on the bottom right, that's sort of the big question mark here in terms of the option to use the Medicaid opportunity and the law to fill this gap in Badger Care. And this slide sort of emphasizes why I prefer to call it a gap. Higher income childless adults are going to be eligible for subsidies through the exchanges. It's the low-income childless adults who now are on that waiting list or could get on the waiting list for Badger Care core coverage who are only going to be covered in Badger Care if our state elects to expand Badger Care eligibility for them up to the 138% level. We cover parents now already up to 200%. A lot of other states don't, but it's really that population of adults who don't have dependent children where the state needs to decide whether to take advantage of that opportunity or not. For just out of interest of time, I won't go through much of this chronology other than to say that we learned last week that Governor Walker decided that he will defer to the federal government and allow them to develop and run an exchange in Wisconsin. There is, Jenny said that looks likely. I mean, the governor made it quite clear that's his intent. I think some of us will keep urging the governor to reconsider. States can come in later on and decide to operate a state-run exchange, and they have until February 15th of next year to say, you know what, why don't we do this in partnership with the federal government and submit plans for a partnership exchange. And I hope that state officials will still consider that option. But there's a lot of work to be done between now and, a lot of work between now and October 1st of next year when the open enrollment starts for exchange coverage. Roberta had asked me a couple days ago to talk just a little bit about the governor's rationale for deciding that the state wouldn't develop its own exchange and to let the federal government do it. These are his words, not mine, to his rationale, so this is verbatim out of their release for last week. In essence, what it boils down to is that Governor Walker and a number of other Republican governors have said that they don't think federal officials are providing enough flexibility for the states, aren't letting states set up the kind of exchanges with sort of less regulation, much more open in terms of what kinds of insurance can be offered, that a much freer market of exchanges than what federal officials may have in mind. So basically they're saying there's not enough flexibility for the states to do what they want, therefore the final product is going to be dictated by federal law, not by state discretion, and that in light of all of that, that they think that it just isn't worth the downside risk, which the governor described as a risk to Wisconsin taxpayers of the costs of administering the exchanges going forward. On that point, I'd say that, first of all, that the federal government over the first couple of years will pick up all of those administrative costs. But then beyond that, the costs are going to be covered by assessments on the providers participating in the exchanges. So there really should not be any cost to the state. Now, you could call that assessment on providers a state tax, and maybe the governor doesn't want to be responsible for that. But I don't really buy the argument about this being a risk to taxpayers. Now, I do think there's some risk. I think the risk is mostly a political risk in terms of the possibility that in the amount of time that we have to get this in place, it may not be running as smoothly as we would like it to run or be designed as well as we would like in the 10 months that we have. I think that, well, and also going back to this slide in terms of the argument that there really isn't any flexibility and it's going to look the same regardless. I think most of the healthcare providers and advocates who weighed in on this and who almost uniformly urged the Walker administration to go with a state-run exchange, I think it makes a lot of difference, that there are a whole lot of decisions to get made that will influence what this looks like, and that state-level officials could have tailored the exchange to fit the particular needs of Wisconsin much better if this had been done at the state level, assuming that state officials had really wanted to make it work. So I think it really does make a difference, but I think if you look on this next slide at the decisions that have been made as of last Friday, at which states are going to be have decided to defer to the federal government and which states are operating state-based exchange, you see that there's a pretty significant partisan dimension to it. The yellow states are the ones that have said that they aren't going to do it, that the feds are going to have to do it. The blue states are states that are going ahead with a state-developed state-run exchange, and the purple states have indicated an interest in a partnership exchange. The white states haven't decided yet. If you compare this map to a map of the party affiliation of state governors, you'll find that pretty much Democratic governors are going ahead with state-run exchange. Republican governors aren't. It's a little more complicated than that, of course, because it also is the variable of the state legislatures, et cetera. But so I think one component of what's going on in the decisions of those Republican governors is they're less enthusiastic about the law, less enthusiastic about really rolling up their sleeves and trying to make it work. Or at least that's one hypothesis. Now, another hypothesis is that, to explain this map, is that there's a lot of work to be done. Wisconsin jumped in. The Doyle administration began very quickly after the law passed in 2010 to form different groups within state government to tackle all the different aspects of this and to make this law a success. That really slowed and gradually came to a stop in 2011 under the new administration. And so we simply haven't been proceeding in a lot of other states with Republican governors where they said, let's wait until the Supreme Court acts, let's wait until the election to see if we want to go forward. In those states, there simply hasn't been progress made on a lot of complicated decisions that have to be addressed. And so it's a huge amount of work and a political risk to take that on. I should add that this particular slide came from it's from the state reform site. There was also this slide from the Washington Post, what's called the WONK blog, which I just love at the Washington Post, go figure. But the Washington Post slide, I put up here, I won't go through it, but just to show everything that has to be established really over the next 10.5 months so that by October of next year, exchanges are ready to start taking applications. It's a huge amount of work that needs to be done, and in conjunction with this, figuring out each state's market, it's going to be very difficult for the federal government in somewhere upwards of 20 states to get this worked out. And part of the complexity is you have to have a smooth working interface between computer systems, in both the state computer system, the federal system for the portal. Wisconsin had begun making a lot of progress on that back in 2010, but hasn't continued to make that progress in the ensuing years. So I think some of us may need to sort of ratchet back people's expectations of just what the exchanges are going to look like when they really start up in 2014. I think, as I said, we're going to have an exchange in place. I don't think it's going to be as good an exchange as we might have had if we'd been working on it the last couple of years. And then my last slide, I just want to talk about the next state budget. So there's some really key decisions that need to be made in terms of the shape of Badger Care. As I indicated, there's the question of whether we're going to take advantage of that Medicaid opportunity in the law to extend Badger Care to all adults, in particular adults without dependent kids, up to 138% of the federal poverty level starting in January of 2014. I raised the question there of how much will that save. I think it's going to be a net savings for the state because what the law says is that newly eligible adults, for newly eligible adults, the federal government will pay 100% of the cost for the first 3 years, 2014 through 2016. In Wisconsin, although we've been covering a modest number of childless adults, they're not getting a full Medicaid benefit package. So we think that for that reason, even those adults who are already covered in Badger Care will be eligible for the full 100% match. Unfortunately, the feds haven't definitively answered that yet. We hope we'll get an answer to that in the next month or two. But if that is in fact the case, considering that the state currently spends close to $30 million a year of state funds for coverage of that population, there's some significant savings there if we exercise this option, cover all childless adults to 138% of poverty, and get full federal funding for that over the first 3 years. That matching rate would then gradually decline to 90% by 2000, but it's still a great deal financially for the states. As I indicated before, another question is whether the Walker administration will propose dropping coverage to adults over 138% of the poverty level. As an advocate, I hope they won't. I hope they'll consider something called the basic health option, which is a different way of covering that population and getting the feds to pick up all or nearly all of the cost of that. And then sort of a backdrop against this, these questions need to, or the first question needs to be considered strictly from the perspective, the fiscal perspective of what will it cost for that particular population to be covered. A separate question is what's going to be the cost to the state Badger Care program of what's sometimes called the woodwork effect, or I prefer the welcome mat effect, that as the law is administered, as people understand, people who are already eligible, understand that they're eligible, or go to apply for exchange coverage and find out that they're actually eligible for Badger Care coverage, you're going to have a lot of already eligible people coming into the program, and there are costs for that. They're separate from the decision about whether we exercise the Medicaid option, but they're a fiscal reality for the state in the next budget. And so what is the Walker administration going to do as we grapple with that cost? And then sort of aside from all of that, they may dust off some of the proposals from last session to change Badger Care. I think they're continuing to push the idea of restricting Badger Care benefits. So, and I'll stop there for interest of time, but so those are some of the key questions we need to address in the next budget. Thank you.
Okay, thank you so much. I'm just going to ask one question of you real quick. Like I said, we've had quite a few come in already that we will address after the presentation. But one question that's come in that I think is interesting is somebody wanted to know kind of what the effects of the Affordable Care Act implementation means for Medicaid programs like Badger Care Plus Prenatal, in the sense that, and this is a program for those of you who are not familiar with it, that provides coverage for women that are undocumented and pregnant. So this person just wants to know if that program will still be available, or if we know any effects that ACA might have on that.
Well, let me broaden the question. It sort of raises, I'm sure one question people have that we haven't addressed is how does it affect non-citizens? And under Badger Care, lawfully present children are eligible for Badger Care. Adults who are lawfully present are only eligible after they've been in the U.S. for 5 years. The law doesn't change that. Those Medicaid eligibility rules with respect to Badger Care eligibility, those will stay the same. But for lawfully present adults, they will be eligible, if they're over the poverty level, eligible for subsidies through the exchanges. So that's one positive aspect for immigrants. With respect to we do provide coverage to undocumented women in the prenatal program because those infants are going to be U.S. citizens and residents of Wisconsin. And I don't think the Affordable Care Act doesn't change that. I'm not positive whether the maintenance of effort requirements would prohibit us from changing that eligibility. But I can't answer that.
Okay. Thanks so much. I think we'll go ahead and switch gears.